Hi, this is Dr. Tom, and I thought today that I would talk about one particular medical condition, hyperlipidemia. And the reason that I have picked this one topic is this is one thing that can pertain directly to fat loss for the HCG diet. Well, people have to remember that hyperlipidemia means an increase in cholesterol levels. It can be an increase in triglycerides, low-density lipoproteins, the very low-density lipoproteins, as well as a decrease in your high-density lipoproteins. Dyslipidemia has been misunderstood, I feel, even in the medical profession, because the answer to increased levels of cholesterol production is to stop the production of cholesterol by inhibiting its production in the liver through CoQ reductase. That's like shooting the messenger. The reason that people will produce high amounts of cholesterol is that, first of all, you have to remember that cholesterol has important functions in the body. It is a large constituent of all of our cellular membranes, as well as the basic building bone for all of our hormones. When we inhibit the production of cholesterol, we inhibit the production of these important functions, as well as inhibiting the production of CoQ10 in the heart. Using statin drug therapy can contribute to the decrease in CoQ10 of the heart and increase non-coronary artery disease, congestive heart failure. The reason that people will produce more cholesterol in their bodies is because of inflammation. When you have a damaged artery or arteriole due to either high blood pressure or just normal wear and tear, it damages a very, very soft, very thin layer called the intima of the vessel. If this damage were to continue without any type of damage control, we would all have aneurysms. Our aneurysms would burst and we would die. However, this doesn't happen regularly. This can happen when the aneurysms get large enough at an older age, but if you ever asked yourself, how did these people survive this aneurysm for so many years? That's because you have a protective mechanism in the body that when you damage this intima, you get an inflammatory response. The inflammatory response is a reparative response. It comes to this area, you have to have some mortar to patch up the hole, and that's when cholesterol is produced and produces a plaque in an area of damage. So look at it as using some plaster to patch up the hole. The key, however, is that most people who suffer acute heart attacks, acute coronary syndrome, acute strokes is because of a rupture or an embolization of a plaque. In order for a plaque to do this, it needs to be calcified or become brittle. This happens through oxidation. So when plaque is built up, especially in the form of low-density lipoprotein, you get oxidation, which is inflammation, you form foam cells, and you collect calcium, and you get a brittle plaque. And these are the dangerous plaques. The answer to this problem isn't to shoot the messenger by decreasing the production of cholesterol. The answer is to lower inflammation in the body. Now, this is evidenced by cardio-C-reactive protein levels, which are a direct indication for heart disease and what your chances of cardiac risk are throughout your life based upon these elevated levels. Again, that's cardio-C-reactive protein or the high-sensitivity C-reactive protein. Antioxidant therapy can decrease the oxidation of these, but probably the most important pro-inflammatory substance in the body is fat. So fat loss can decrease cardio-C-reactive proteins, decreasing the inflammation in the body, stopping the oxidation of formed plaques, and can save your life. Thank you.